Hello, I'm Dr. Harry Croft, and I want to begin by thanking you for watching this DVD. It's about a subject that I think should be important to all of us. Most of us either have a family member or friend who suffers from Alzheimer's disease or knows someone that suffers from the condition. It's a common condition affecting way too many people. It's estimated that about 5 million Americans suffer from this condition. That's the bad news. But the worst news is that number is expected to triple within the next 30 or 40 years to get larger, not smaller. And that's important. I want to come back to that. It is a very costly illness, and the cost is going to triple too in the next 30 years. Why? Because the most common risk factor for Alzheimer's disease is aging, and our population is getting older. It's primarily a disease caused by degeneration of the brain cells, and it occurs generally in those over the age of 60. I'll tell you more about that in just a second. It kills a lot of people. Cancer kills 500,000 Americans per year. Alzheimer's disease kills about 500,000 Americans a year. You might say, well, they're about the same. But remember that cancer numbers are going down and that Alzheimer's numbers are tripling in the next 30 years. That gives you an idea of the impact of this disease. 1 out of every 5 Medicare dollars goes for the treatment of Alzheimer's and related conditions. The government spends about $5 billion a year on research for cancer, research for heart disease, research for AIDS. You know what that number is for Alzheimer's disease? It's about 1/10 of that number. And yet Alzheimer's disease is the only one of the top 10 major diseases that kill people. It's the only one that can't be cured, prevented, or even slowed down. So we're going to talk to you later in this DVD about things that can be done to help prevent these staggering numbers from continuing. And basically, that's doing research into not only what causes the disease, but what can be done to treat the disease. Most of us kind of worry as we get older that we forget where we put our keys, or we forget why we've come into the kitchen and looked in the refrigerator. We knew just a minute ago, and we worry about that because we think that's Alzheimer's disease. That by itself is not Alzheimer's disease. It's probably what's called age-related memory loss. And that's something that just happens as we get older. We get a little more forgetful. It's a little difficult to remember the name of that person. We know them, but we can't call their name. But later that day, bingo, it comes, oh yeah, that was Joe. That's probably age-related memory loss. The next step in progression of worsening of our thinking condition is called mild cognitive impairment, or MCI. Mild cognitive impairment is that memory loss condition, but it's a little bit worse so that more people notice it. And if we did testing for it, we could tell that it's a little more than the average person might have of memory difficulty. But with MCI, people are still functioning day to day. They're working, they're doing what they need to do around the house. They're getting things done. It's important, this MCI stuff, because much of the research that's being done now to help prevent the devastation of Alzheimer's disease is looking at those not with the worst part of the disease, but rather those with this mild cognitive impairment. And there's some tests we do, memory screens we call them, to see if people have just age-related memory loss or mild cognitive impairment. And you can find some of those screens at the Alzheimer's disease website, alz.org, and or you can go to our website of Clinical Trials of Texas called saresearch.com, and we can give you some links to those tests that can be done. Those are generally pen and paper tests. They only take a few minutes, and they're easy to do. And they can give us the information about whether somebody has this mild cognitive impairment. The next step after MCI is called dementia. And you know, a lot of people ask me, so what's the difference, Dr. Croft, between Alzheimer's disease and dementia? Because we often use those terms interchangeably, and for the most part they are. But dementia means a cognitive problem, a problem in thinking due to degeneration generally of the brain that causes problems with memory, but also other things like speech and depth perception and ability to do things that are a little more complicated. That's called dementia, when we have the memory loss, but it begins to affect our ability to conduct our everyday lives, so that people may need help around the house, or help, or can't do their job the way they used to anymore. That's dementia. Alzheimer's disease happens to be the most common type of dementia, but there are other things that cause dementia that are not Alzheimer's disease. So Alzheimer's disease is the most common type of this condition called dementia, which means not only the memory, but memory and other symptoms of thinking and performance that impact negatively on our day-to-day lives. Who's at risk for Alzheimer's disease? Well, there's certain things that put people at risk. If you've got a strong family history of Alzheimer's, it may mean that you're at a little bit greater risk, but not a great deal, unless your family is one of those very rare families that have a problem called early onset Alzheimer's disease. And that's Alzheimer's disease that generally starts in the 40s and 50s. If any of you saw the movie I'm Still Alice, Alice in that movie had early onset Alzheimer's disease because she had genes for that particular rare type of Alzheimer's. There is a gene that some of you may have heard about. It's called the ApoE4 gene. I won't bother you with all the intricacies of it, but that particular gene, you get one copy from each parent. So if you have only one parent with that gene, your risk of getting Alzheimer's disease is about 3 times more than the general population. If you have both parents with the ApoE4 gene, your chance of getting it is 10 times greater. But there are still people who have both copies of the ApoE4 who never get Alzheimer's disease. Just like with the mild cognitive impairment I told you about, there's some people who get mild cognitive impairment but never ever go on to develop Alzheimer's dementia. So one of the risk factors is family history. Remember that age is the biggest risk factor. So if your family member had onset maybe in their 70s or 80s, that may not put you at that much greater risk, but it could. Other things that are unrelated to age and genes that may cause it, head injuries, concussions, can put you at greater risk. Diabetes can, cardiovascular, heart disease can put you at greater risk as well. What can we do about Alzheimer's disease now? And that's part of the problem, is that we don't have many good drugs that can slow down the development of Alzheimer's disease or prevent it or cure it. And again, that's what we're working on here at Clinical Trials of Texas, to try to help determine if there are new medications that may help. More about that in just a minute. Let me talk next about how do we diagnose Alzheimer's disease. Well, first of all, we do some of the memory tests that I talked about, and then we do a little more complicated kind of memory tests. Again, they're generally pen and paper tests that we do to check how much memory or thinking difficulty do people have. We take history from informants, those people living with the person that may have Alzheimer's disease, because they can sometimes tell us things that the patient can't remember. And then we generally do some laboratory testing, not to diagnose the condition, to make sure that it's not something else like thyroid disease or diabetes or something else, the vitamin deficiencies that can get in the way. And then we generally do, if we're suspecting this might be Alzheimer's disease, an MRI scan of the brain, which helps us to determine what the brain looks like and to make sure that this is not maybe a stroke or something else that may look like Alzheimer's disease, another cause of dementia that may look like Alzheimer's disease. But we don't yet have the definitive test for Alzheimer's disease. That's coming in the future, and that's part of what we're investigating. What kind of test can tell us that somebody has Alzheimer's? What we're looking for is something called biomarkers. And the reason I tell you that is you'll read about that or hear about that on TV. So let's say we determine this is Alzheimer's disease. What can we do about it? Well, I'll talk about treatments in just a second, but let me talk about prevention for just a minute. The things that have been shown to work to help somewhat with prevention are regular aerobic exercise, 20 minutes, 3 to 5 times a week, a diet that's heart healthy, that heart healthy diet, the Western diet or Mediterranean diet is the one that's talked about the most. The Western diet with a lot of fatty food and a lot of carbs, that's not as good. We can use vitamins, but some of them have not been shown to help all that much. We thought for a while that vitamin E would do the trick, that vitamin D might do the trick, that ginkgo biloba might do the trick. None of them have been shown to really help all that much. There's a lot of hullabaloo right now about curcumin, turmeric, that it might help, or coconut oil might help. But we haven't shown scientifically that those really work yet. And then many of you have seen on TV those ads about the jellyfish stuff. You can get that in capsules. And you might be interested to know that the FTC, Federal Trade Commission, just cracked down on the advertising for that particular product, saying that it may not be true. What's the harm in doing those kind of vitamins and stuff? Well, you might say, let the buyer beware. but it may not help. Vitamin E may produce bleeding problems, or taking nutritional supplements may keep people from getting other treatments which might be more effective at least for the time being, making people look better. And then there's some medications that a doctor can prescribe. The most common ones of these are called acetylcholinesterase inhibitors, big long name. It may look like it slows it down a little bit, but the slope of the worsening continues. So those aren't the answer just yet. What is the answer? Well, it has to do with looking at new ways, not just of treating the disease, but in preventing the disease from worsening. Maybe to prevent it from going past the mild cognitive impairment stage, or maybe from preventing the problems in the brain, the accumulation of abnormal proteins in the brain, proteins called amyloid proteins or tau, T-A-U proteins. Some of the studies we're doing now are looking at, can we do something to prevent the accumulation of those proteins or to get rid of those proteins once we find them in the brain. And the way we find them, by the way, is to do a fancy-dancy scan of the brain called a PET scan, which isn't used clinically but is used in research now. It shows up this amyloid or this tau stuff in living color so we can see it early on in the disease. We're certainly working on development of those agents. And that's where we need your help. We need your help in one of several ways. One is to help get educated, to support those and those families with the disease, to give money, if you can, to the nonprofit agencies that may help ultimately in prevention of this disease, to contact your government representative to say, look, we need more money to develop treatments for this disease, and then finally to volunteer for clinical trials. Why would you want to volunteer for a clinical trial? Well, the trial you participate in might be the one that comes up with the agent that might in fact treat or prevent this disease. The other reason for being in a clinical trial is you get to get some of these tests, like the PET scan and the MRI scan, and you get seen every week or every few weeks or every month or two for a long period of time. You get care better than you would get from your private doctor because the way that the trials are structured. Could you get a placebo or sugar pill if you participate? Yeah, but you're going to still get care that you couldn't get in most places by being in a trial. And I would encourage you to learn as much as you can through organizations like the Alzheimer's organization or others. I would encourage you to go to our website. We've got information at saresearch.com that may be of help to you. And to learn what you can so that you can be part of the team that ultimately may find the answer for prevention and maybe even cure for this disease, which is so difficult and so problematic. I thank you very much for watching this DVD. I hope there was some information there that was of value to you and that you'll continue to learn. And if appropriate, give us a call or go to our website and look into participating at a trial. There are trials going on not only at our site, but at other places, not only here in San Antonio, but around the country. I would encourage you, and each one of those may have requirements that are a little different. So you may not fit the requirements of one trial here, but you might fit the requirements at another agency. I hope you will check into those. Thanks so much for watching. I'm Dr. Harry Croft.